afternoon. Thank you for hanging in there for the end of the day. So I know that all of you are passionate about this topic particularly, so I think we've saved the best to last for today. So with that said, I'd like to welcome our attendees and our panelists and give you a little background about our panelists. We have with us today Dr. Danny Avula, and he was appointed as the Commissioner of the Virginia Department of Social Services in February of 2022 by Governor Glenn Youngkin. Dr. Avula is a former health director of the Richmond City and Henrico County Health Departments, where he served for 13 years. He had the honor, I'll say that with a smile, in January of 2021 to be appointed by Governor Northam to lead the Commonwealth of Virginia's unprecedented COVID-19 vaccination efforts. I must say you did a spectacular job, so be proud of that. He was also appointed by Governor Terry McAuliffe to the State Board of Social Services in 2013, where he served as board chair from 2017 to 2019. Dr. Avula is also a public health physician specializing in pediatrics and preventative medicine, and he continues to practice clinically as a pediatric hospitalist. After graduating from the University of Virginia, he earned his medical degree from VCU School of Medicine, and he completed his residencies at VCU and Johns Hopkins University, where he also earned his Master's of Public Health degree. And he's an affiliate faculty member of VCU, where he regularly serves as an advisor. And amongst other things, I'll say he spent a 16-year resident of Richmond's Churchill neighborhood, and in his spare time, as I always like to say, he spends that devoted to his wife and his 5 children. That's quite the resume. We also have with us Carl Ayers. Mr. Ayers recently returned to the Virginia Department of Social Services as the Deputy Commissioner for Human Services after several years as the Senior Director of Strategic Consulting for Casey Family Programs. He previously served in the Virginia Department of Social Services as the Director of the Division of Family Services, which is responsible for the supervision of child protective services, foster care, adoption, prevention services, interstate compact on the placement of children, and on adoption and medical assistance in Virginia. Next, we have Rebecca Morgan. Rebecca has served as the Director of Middlesex Department of Social Services since 2012. And since 2003, she's worked in 3 local Department of Social Services agencies throughout Virginia. She currently serves as the President for the Virginia League of Social Services Executives and is the past chair for the VLSSSE Legislative and Child and Family Services Committee. And I must say, every time I encounter Rebecca, she's full of energy and enthusiasm and knowledge. You really have been. And last on our panel today is Mira. She has spent more than 15 years in the public and private and nonprofit sectors, focusing on system changes and service delivery improvements in mental health, substance use, disability, and child and family services. She currently serves as a special advisor to the Safe and Sound Task Force. And in this role, she works alongside the administration and diverse stakeholders to support and transform the lives of these vulnerable children and their families through a multi-agency approach. So with that said, I'd like to welcome you all here today.
Well, good afternoon, everybody. I will go ahead and kick us off. I will say I at least am very glad to be interacting with you on something that's not COVID, which is how I know many of you. But seriously, thank you for just your connectivity, your advocacy, the work that you all did in your local communities. Virginia did remarkably well during the pandemic, and it couldn't have happened without local government support, leadership, involvement. So I'm really grateful for the role that you all play. I wanted to spend just a few minutes kind of providing some context about what's going on in the world of social services, and then our experts will really kind of go deeper, and we'd like to leave as much of this time driven by your questions. So I want to start just with some of the priorities of our administration. The governor ran on these kind of 5 key issues: cutting costs, costs, keeping communities safe, reinvigorating job growth, a big focus on excellence in education, and then improving government efficiency. And that really was the focus of this first 10 months in office. There have been some tremendous gains in these areas, and so I wanted to kind of show you and give you a sneak peek into what is evolving as his Day 2 agenda as it relates to the HHR portfolio. So I spent the Tuesday last week with the Secretary of HHR and all of the different agency heads talking about for HHR, what are the things that are really coming into focus for this next year. One, behavioral health redesign. Many of you all, just in your local communities, probably feel the pain of the acuity of mental health illness that your residents are facing, and the fractured system that exists to be able to meet those needs. And so a lot of folks, I will say, I'm really glad I'm not the commissioner of PBHDS right now, because it's a lot of focus, a lot of work. Nelson Smith is an amazing guy and is doing great work. And so I expect the next couple of years we'll see some pretty big shifts in the landscape of mental health service delivery. Medicaid unwinding, we'll talk a little bit more about that, but basically we dodged a little bit of a bullet this past Friday. We thought that the public health emergency was going to go away. It does not look like that's going to happen, hopefully for 3 months, though we're not sure. I'll talk a little bit more about that in a second. Foster care and an adoption, you'll hear more about that from Mira. A focus on the city of Petersburg. So I don't know if Petersburg, well, city, no. Petersburg not being represented here. But really, I think the governor, in a recent visit to Petersburg, was really compelled by both the chronic disinvestment, but also the heart of the people in that city. And so I think this will serve as an example of how state and local can start to work together to help solve problems on the ground. And then workforce. I mean, all of you know better than anybody how much of a challenge in local government and local public health care and education, law enforcement, DSS, how much the workforce is ailing right now. There is a particular focus in this next year on nursing because of just the gaps in acute health care that are existing in hospitals and outpatient settings across the city. All right, so let's talk a little bit about unwinding. I imagine most of you have context for this, but basically, beginning the pandemic, federal public health emergency, for Medicaid, what that meant is that nobody could come off of Medicaid, right? So for 2.5 years, we've been in a situation where people have been adding to the Medicaid rolls. Nobody can come off under the public health emergency. Once the federal public health emergency goes away, we then have basically a 12-month period where we've got to go through those 2+ million individuals on Medicaid and predetermine whether they're actually eligible or not. Now, as you can imagine, this is going to be a very, very heavy lift for your local departments of social services staff, right? For a couple of different reasons. One, it's a lot more work. I mean, we're expecting about 2.2 million people on Medicaid. Normally at baseline, we're about 1.5 million, so a huge increase in the number of people that we actually have to predetermine. But two, our workforce has experienced a lot of churn in the last 2-3 years. There are many, many individuals in local departments of social services who never actually had to do this work. They've never actually had to predetermine an application. So we are really focusing on training. We started that a couple of weeks ago, training this new workforce on how to do these Medicaid redeterminations. The first bullet there, January 11th was when we expected the public health emergency to go away. The federal government has assured us that they will give us at least 60 days notice before that happens. That did not happen on Friday, which would be 60 days before January 11th, okay? So what we expect is that this will likely get pushed into April. Now, the federal government could decide in 2 weeks, hey, we're going to give you 60 days notice, and it will be, the end of January. So we don't know for sure, but what we've been seeing happen is that basically the can gets kicked down the road every 90 days or so. And frankly, from the DSS perspective, this is a huge relief, right? It just gives us more time to try to build and train that workforce, to build a centralized group of folks that can help with flex to support the local departments. It helps us make sure that we're doing the automation right. So of those 2.2 million-ish individuals under Medicaid, we're hoping that about 50% can be resolved through system automation, like just the system recognizing certain categories of income that would kick somebody automatically into another year of Medicaid. And then we are really going to work with our legislature in the next couple of months to make sure that we have the resources needed to pay local departments overtime and to add kind of this centralized role. So those are some of the big things, and certainly Carl and Rebecca can talk more about that. The connectivity of the workforce is another big issue. So social services, our connection to workforce is primarily through the TANF VIEW program, which we have gone ahead and during the public health emergency, the employment part of TANF, the VIEW program, has been optional, and almost everybody opted out, right? We had about 5% participation in TANF VIEW. We went ahead and decided to make it mandatory again, which means that anybody receiving TANF now has to participate in the employment program starting in January. Now, the local caseworkers have some discretion there, right? So, for example, in your community, if child care still isn't available, that local caseworker can say, okay, you have a pass on participation in this program. But by and large, we expect everybody receiving these benefits to get plugged back into the workforce, and hopefully that will be a clearer pipeline to work, because we need people working. So that's the piece, TANF VIEW, SNAP ENT, that's the piece that social services touches, but there's a whole other ecosystem of workforce providers, whether it's the WIOA-funded workforce boards or nonprofits, or some localities have kind of built out their own workforce programming. And so a big initiative out of the Secretary of Labor is to figure out how do we tie those pieces together, create more of a pipeline and connectivity between social services, WIOA, and other types of programming. So the Secretary of Labor is undergoing a huge kind of statewide mapping of these resources. And so we'll expect to hear progress on what that network looks like. Supporting local DSSs. So I will say, and I told Rebecca and all her colleagues as local DSS directors across the state 2 weeks ago in Stanton, that the issues that our local departments are facing from a workforce standpoint, I mean, we're seeing 20 to 40% vacancy rates in some of our local departments, in some of our services or benefits. I mean, it's really, they're really struggling. And so, as sitting in the seat as commissioner, focusing on that workforce is my biggest priority. Figuring out how to help stabilize that workforce. That is going to require some help from you all, because this is a recruitment issue. It is a pay and competitiveness of pay issue. It is a challenge of just the environment that many of our frontline DSS workers are working in. Every local department I go to, I'm hearing stories from the front line about just the acuity of the family situations they're walking into. The threat of being assaulted, the challenge of having to walk into a home at 1 in the morning and make a decision about whether a child needs to be pulled out of the family. I mean, these are really difficult jobs. And we expect a 25-year-old social worker making $45,000 a year to make those decisions. And so we've got to figure out how do we appropriately prioritize and fund those roles. So a big focus for us as the state agency is how do we support the local DSS workforce. And again, because of the local match and because of the roles that you all play, there's a lot of partnership between state and local that needs to happen. Digital transformation. So this past year's budget, we got about $100 million to address some of our significant technology challenges. Some of you know we are working on systems that are 20 and 30 years old. And that creates a lot of issues for our local workers who are frustrated by the inefficiency, the lack of connectivity that they're facing. So we have about $6 million to try to just build better pipelines of information. So the data transfer between state and local, opening up those, going from T1 lines to 100 megabit per second lines. Like, that's some of the work that's happening right now. And then we are rebuilding our child support enforcement system and our child welfare system, CWIS, the system that all of our foster care workers use. So a lot of work there. Some exciting work about the benefits cliff. So I imagine most of you are familiar with the reality that many of our families who receive benefits, whether they're on SNAP or TANF or child care subsidy, the way that our systems currently are set up is that, hypothetically, if you're making $40,000, you'll get some benefits. If you make $40,001, you're off of those benefits, right? And so every day, our families are being faced with decisions about, do I take a job where I get paid $2 more an hour, or do I move from 30 hours a week to 40 hours a week? But if I do that, I'm going to lose some benefits. And so they're calculating in their own heads, is this financially beneficial for my family or not? And like all of us in this room, many of us would not make that decision to financially harm our families. And so we've got to figure out how to build a better system so that people aren't making those decisions, that they've got to be able to find work that sustains them that doesn't financially harm their families. So right now I'm working with the administration. Carl and I and our team at the state level are putting together a proposal where we would use discretionary TANF dollars to help smooth out that benefits cliff curve. It may not happen this year, but I feel like we're getting traction with the administration, and we're talking about this issue a lot. A lot more people are understanding how the current benefits setup actually serves as a financial disincentive for work. So I feel like in the next couple of years we'll have some opportunity to solve. And then building better bridges, state, local DSSs to connect to their workforce boards or their community action agencies. I think there's always more collaboration that can happen. Foster care and adoption, well, I mentioned that as a priority for the governor. The Safe and Sound Task Force was launched. This is Janet Kelly, who's a former Secretary of the Commonwealth. She's now a senior advisor to the governor. She's leading this charge. Mira is on her team. You'll hear more about that in a few minutes. And part of what is happening in the foster care and adoption world is this shift from, the sort of knee-jerk process of identifying a bad situation, pulling that child out of a family and putting them into foster care, and then hopefully finding permanency for them, to kind of move to the left of this spectrum, right? To really support foster care prevention, find preventive services in communities, whether that's substance use or mental health or parenting classes or whatever the case may be, and really try to come around families so that we don't find ourselves in situations where we have to pull the kid out of the family. We've seen the data, we understand the impacts of removing the child from their family, and it is always better to keep them with not always, it is often better to keep them with their families with the right supports than it is to either put them in a foster situation or to institutionalize them. And so we're really working to move up the spectrum towards prevention. One part of that is kinship care. So we have made some significant improvements as a state to find kin placements for kids who need to be pulled out of their families, right? So again, the data is very supportive of kids being placed with foster families that are relatives, grandparents, aunts, uncles, or what we call fictive kin. Pastors, coaches, teachers, community members who have a pre-existing relationship with that child. That relationship makes a huge difference in terms of the longer-term outcomes of permanency, return to family, and reduction in abuse in those foster care situations. So there's a big focus on kinship care. Over the last 2 years in Virginia, we've gone up from about 6% of our kids in kin placement to just about 12.5%. That's a great step forward. The national average is like 33%, and there are states that are north of 55 or 60%. So we've got a long way to go, and that means we've got to do a better job of finding families, of prioritizing kin placements, but also of financially supporting them. Because if we don't financially support a distant uncle or aunt or cousin the same way that we would a non-relative foster placement, we're not going to get the outcome that we want to. So a big focus on kinship care there. All right, you'll hear more from Rebecca and Carl about our shared accountability work group, our dashboard work, and then the local allocations that's going to, we're sort of rethinking the way that money is distributed to local communities. All right, I'll stop there. I'm going to load you up there, and then we'll go to Carl and Rebecca.
Can you all hear me if I stand here? Okay. If you can't, or if you're feeling feeling shy about raising your hand, please don't, because I want you to be able to hear me. So good afternoon, everybody. It's wonderful to be here today. Thank you very much for the invitation. Thank you for the work that you do each and every day. So I wanted to spend just a little bit of time. I'll probably go even a little bit higher level in terms of the Safe and Sound Task Force and what we're working on. But I wanted to give you an overview and how that ties into the work that is taking place, not only within social services, but also with a number of other agencies within the Health and Human Resources. So Safe and Sound Task Force was launched on April 1st, as Commissioner Avula mentioned.
Hello.
It had a few broad goals. The first sort of most specific major goal was kind of ending this phenomenon or this problem that maybe some of you are familiar with of children, youth in foster care, sleeping in unsuitable places, specifically in offices or hotels, or sometimes in emergency rooms, sort of unnecessarily. And then some of the other broad goals were around finding reservoirs and securing reservoirs of safe placements for any child who needed them. And then sort of third, really going further upstream and looking at all of those underlying systems issues and policy changes and all of those ideas and recommendations and things like that, whether you're at the local level or state level, to really address those foundational aspects that are driving at, number one, why are children ending up sleeping in these unsuitable places, and what can be done about those things. So, stopping this sort of critical problem, but then over time, really moving upstream. We had about 70 to 100 stakeholders involved from all across private sector, public sector, local government, state government, providers from across residential providers, behavioral health providers, certainly social services, so on and so forth, that a number of times in person and have really been sort of rolling our sleeves since then. I wanted to talk a little bit about some of the sort of national and state contexts that are also really sort of playing into this, this issue, which is, number one, first, that this is not just a Virginia problem, and in some ways it's sort of a little piece of a kind of a larger issue in terms of a lot of the reforms and the work that Commissioner Avula and that Carl and Rebecca are working on both state level and locally. So lots and lots of other states are working on child welfare reforms as well as mental health care reforms and trying to understand the intersections there and how does one affect the other and what are the levers that can be pulled and what needs to be addressed in order for both of those systems to really work well together so that in the end it is the youth and their unmet needs that are able to be fulfilled. So we're able to talk to other states and learn from them, and hopefully that will be something that will help us as we sort of move forward in this process. In terms of the sort of mental health overlay, I came from Department of Behavioral Health and Developmental Services, so I am very oftentimes looking at this issue through that lens. I think we're still trying to understand exactly how they do intersect and how they relate exactly. We do know that over half of youth and young adults, this is a national statistic, but we know it applies generally in Virginia, over half of youth and young adults who need mental health services are not able to access them, when they need them. And there are, all kinds of reasons for that you're probably familiar with. And when they do access them, they tend to be sort of the more high acuity, crisis-oriented. Maybe they've been asking for help or needing help for long periods of time, but haven't been able to get it. We have lots of ambulances in our system and not necessarily enough seatbelts. So what can we do, system-wise to, we need the ambulances. I'm not saying we don't need them, but, we really probably need to kind of shift that a little bit. And, obviously the impact with youth in foster care is tremendous. When you think about the trauma that is just rooted naturally in foster care in terms of, the grief and loss and separation, that's a very real mental health impact. It certainly is something that can be tended to and treated, but we're really not quite there yet. There's a provider shortage, in Virginia. There, was a lot of great sort of pivoting during the pandemic to telehealth. A lot of that has been actually sustained and kind of integrated into the social delivery system, which has been excellent. I mean, I know I have taken advantage of telehealth with my doctors, and frankly, if I can do a lot of that, I'll be super happy because it saves, time, driving, things like that. But lots of folks don't have access to, even broadband yet, or, steady access to smartphones and things like that. And so, particularly with folks who are perhaps on the margins or, things like that, it can still really be elusive in terms of taking advantage of some of the advances with, mental health, telehealth, and things like that. So really trying to think about how that has an impact. I'll just skip through some of these real quickly, touch on them. So with the aligning resources and immediate needs, when we launched the task force in April, there was a very immediate, urgent sort of call to action from the governor, which was, he was aware of this sort of huge problem, and I'll go over some numbers real quickly. Before he took office, he really, wanted to kind of wrap our arms around that in terms of, moving away from that. So we had this crisis on our hands, trying to, kind of get all folks together, agencies together, state, local, so forth, to address that crisis. And so, you marshal resources towards that. But then you also have, all of the systems, long-term sustainable changes that you really want to make, and that takes time. So, you're trying to do this sort of balancing act, and there's only so many resources at the end of the day, especially with, folks who are on the front lines, so to speak, who are, taxed and overwhelmed and overworked, but you really need them. You need them in both areas. Lots of system gaps that we're sort of uncovering, but, probably also knew they were already there. And sort of dealing with lots of, we sort of call them high acuity youth who are frequently displaced from placements and often wind up in the offices or hotels. And the way we sort of define high acuity youth is, their needs exceed the resources that exist in really any one system. So there are multiple systems that touch on this youth, whether it's, social services, mental health, Medicaid, CSA, FACT, so on and so forth, you name it, PCP, whatever. But that's a lot of people, there's a lot of entities, there are not necessarily clear lines of authority between them all, but we need them all. We need them all talking and coordinated and engaged and, on a unified plan and marching in the same direction. And, systems are not always set up to support that in the best way possible. So we're really trying to work on that. And treatment and practice gaps, just to use the example about trauma and trauma-informed care, lots of advances in evidence-based practices around, trauma needs of youth and families and what is needed, but the gap between, sort of when the, body of evidence happens and integrating that into, service delivery and your payment models, whether, private sector or, public sector and things like that, that can be years and years and years to really make that, that happen. And then not to mention, residential providers, by the time sort of it's realized that perhaps there's a specialty need for, let's say eating disorders or youth who have experienced human trafficking or, services on the autism spectrum. There are just gaps that need to be addressed in a timely way as possible, and that takes time. So, just some of the context. Let me try to zip through some of these. So phase one, as I said, was sort of focused on this kind of crisis situation. We looked at the last calendar year, average of 27 youth per month. And then the current average, once we put a few things in place, we were able to drop that down quite significantly to 3 youth per month. And this was sleeping in unsuitable places, although I will add a large disclaimer that this data was from April 1 through the end of July, and we're still working through what the current data is. So we think it's still low, but I don't have that right now. I've kind of touched on some of the things that that have worked, that we want to continue carrying through the work of the task force and some of the other goals that have been identified. I think really most significantly is really looking at this through a multi-agency lens and multi-agency, kind of system of care approach. Yes, these are kids who are in the custody of a local agency, and there are very clear responsibilities and authorities and mandates there. But our view is very much that there are multiple agencies, multiple entities, local, state, that really have a role and a responsibility. And so working through that and figuring that out has been, and coordinating around that has been essential. And then kind of developing a process. What does that look like? Perhaps outside of, for example, FACT, or outside of CSA, or maybe even building on local processes that do exist, that could be leveraged or enhanced to, better get all of the partners together, to rally around the youth and their need. Just ensuring that we're using proven models, like high fidelity wraparound. Something that I really learned about was this framework of what would it take, which has kind of opened a lot of doors and kind of flipped situations to, there's nothing that could be done to, well, we could serve this youth, or this, family could provide respite for this youth, or, there is a kinship family possibility if only they, X, Y, Z, and by having, all the different agencies kind of leveraging their authorities to sort of help make it happen is where we were really able to get kids out of offices, prevent kids from going into offices, and hopefully we'll be able to carry that through in the future. And then, of course, having the sort of authority and visibility of the task force and the governor's authority has helped a lot. I've kind of touched on these in terms of just the overall challenges, really trying to, in terms of service gaps, I think we're still wrapping our minds around the mental health needs of the population, and then need to develop and build out the continuum of care that needs to be there. So that is something that will take a while, but getting the different agencies that have authority, such as Medicaid, of course, EDSS and Families First, localities, CSBs, MCOs, so their authorities, CSA, so getting all of those entities using their resources to help do this has been will be sort of the next steps. Staffing shortages and workforce challenges were touched on. Talked about the process and organizational challenges already. No quick fixes and dead ends. That is a kind of reality that has come up multiple times. Lots of these processes can be slow, and so just trying to be persistent and identify, are there modernization, activities that could occur, where are efficiencies that could be gained that perhaps are sustainable, and then just the multiple accountable entities. Again, lots of different people and agencies and things like that responsible for the care and support of a youth, and really just kind of unpacking those and having clarity about the rules, and then getting them all kind of aligned around a shared plan for the youth has been key. So we do have a few more goals that we will be working on, and of course continuing to have processes in place and work with multiple partners to continue to try and prevent placement disruptions so that kids are not sleeping in offices and hotels and the like. Over time, reducing the use of unnecessary congregate care for youth in foster care. There are lots of kind of examples in other areas, mental health, children with intellectual disabilities, where you're seeing states move further and further away from large sort of congregate care settings. Reducing disruptions reducing disruptions in birth, kinship, adopted, and foster families, so keeping family-based placements intact, and then also recruiting 1,000 Virginians who are educated and equipped, and so this is sort of the community awareness piece where we find that lots of community members are not that aware of this issue, but once they are, they care and they want to know what can they do. And so how can they come alongside government and things like that to help out? So this is sort of a key community engagement piece with supporting kinship families, supporting foster families. So we'll be working on that as well. And some of the specific recommendations that we are working on in partnership with other agencies. So I think I'll hand it over to Carl and
Thanks, Mira. Good afternoon, everyone. I want to dig into just a little more detail on some of the things that you heard about, and I'm also going to force your eyes over here because it's the afternoon and make you move a little bit where you hopefully won't go to sleep off. But I really just want to dig down into a couple more of the details of what the Commissioner and what you heard Mira talk about. What Mira just went through, imagine 27 youth a month day. Now we have 5,400, 5,500 children in care at any given time. We get 120,000 plus calls on children and families per year. Imagine what you saw Mira go into with this small population, and now try to extrapolate that across the entirety of the population we're trying to serve. And so one of the ways that we are always asked at the state level is, what can the state do to support the localities in order to allow the workforce to do a better job of serving our children and families? I want to ask you, how many of you have one of these? Anybody in here who doesn't? No, it's been a while since I've run into an audience that somebody did not have it. Now imagine you're a worker coming into the field to work for us, and we put you on a system that was built in 1990 that we got from Oklahoma for $1. I think we probably got our dollar's worth out of that system, that end of it. And we put you in front of it and we say, okay, go out and work with these families that are struggling with mental health issues, with substance abuse issues, really challenging situations, and let me give you a pen and paper and go out and work with them and try to come up with a complex answer. Is one of the big things we can do at the state is really invest in our technology that will help the workforce to be able to meet those needs. Spend more time working with the family, less time filling out forms, and less time putting information into the system. So, Commissioner talked about the IT investments that we're doing. And so we're currently in the process of replacing our Oasis system. That sounds wonderful, doesn't it? Oasis sounds like someplace you want to be. Not if you open this system. So it's not a place that you want to be. We're trying to get into the modernization of this technology, and so we're building it out. We're creating the system right now that within 2 to 3 years you will have a modernized system that will allow workers to do what they do mobily, out in the field, reduce duplicity, so they're not having to duplicate everything they're doing on paper and in the system. And then actually, one of the things we're putting in there for our vendors is to actually use the data that's going into the system to help guide their decision making. So imagine you work with those families and we say what works, and that the system will actually help us to identify what is working with those families to better make use of our resources. And so that's where we're going with our child welfare information system. The RFP should be out, we hope, early next year. For that end of it, we are doing something called a multi-octave APD. And for any of you in the IT world, what that means is that we are doing a system that requires approval from the state and from all of our 3 major federal agencies. So CMS, FNS, and ACF, which is your children. So that's your SNAP, the one that oversees SNAP, the ones that oversee Medicaid, and the ones that oversee our child welfare programs. So we're actually having an integrated system to help meet the needs of our children and families. So that's being invested, and it's coming to you as localities, as part of what the state provides you to help you meet those needs. So understand that's a large investment that's coming at you. It is going to be well in excess of $40+ million. So just understand this is a large investment that we have heard from localities and said this is something that we go through. So that's coming your way. As quickly as we can get it out there, we will get it out there. And the General Assembly has funded it. So now, that's part of my responsibility is making sure that it happens and that it gets rolled out to you successfully. Another one is around Family First, and we were, if you've been around for any time at all, you know we've been talking about Family First going back to 2015 was the first time that we started talking about this. But what we're really talking about when we say Family First, we talk about Family First Prevention Services Act, which is a federal law around how we interact with children and families. But what you have heard us talking about is that we know long before that federal law passed is that as a system we can do a much better job of serving children and families if we can provide the same sort of supports to kinship families. And whenever we use the term kin, we don't just mean blood relative. I hope you caught that when the commissioner said it earlier. When we say kinship, that means anybody that has a relationship with that child, by blood or not. And so what it does is it helps create that community and that support for that child and family. We want to be able to provide the same sort of supports to that children, to that family, and be able to build those supports throughout the life of that child the same way we would if it were you or I. And right now, up until the passage of the Family First Prevention Services Act for over 60 years, the only way we could use any federal money was after we brought that child in foster care. Think about that. We could not access a single federal dollar to support children and families until that child was removed from the home and came into foster care. Now, Family First Prevention Services Act passes. Now we can access those federal dollars in a different way. It's still too complicated, it's way too siloed, there's too many rules around it, but it's progress towards being able to serve children and families prior to them coming into foster care. And so I hear the words, it's clunky, we're not quite sure where we're going with it. Well, of course we're not. We're doing it one way for 60 years, and all of a sudden we're trying to turn it and change it to a different direction, so it's going to be clunky. We're going to have to answer questions we didn't know. We didn't know because we've never done it that way. We don't have a place to go back to and say, hey, this is exactly what it looks like. And if you read the federal law, which I don't know if any of you had the pleasure of doing that other than me. I'm not putting anybody on the panel, but 107 pages of federal speak. Great sleeping, if you're having trouble sleeping at night. It's a great thing to read. But it's a really complicated act, and we're still trying to figure out in Virginia, how do we do this and how do we best serve our children and families. But the theoretical mindset that we need to move our system from removing children and placing them with somebody they don't know, to building those supports in the community to somebody that they do know, whether it's by blood or not, is a pretty significant shift, and it actually gets us back to the beginnings of social work. Back with their faith-based organizations, and whenever that was really something that was handled by the community and the various religious organizations before the government stepped in. So you're actually seeing a shift back in that direction, which is something we're still trying to figure out and trying to build off of. And I can get into any detail you want to get into that, but I'm just trying to give you theoretically, this is what we're trying to build out as a system, and then trying to answer those questions. So as a community, we want you to be able to spend those dollars serving that child and family inside of their own community, instead of having to place that child someplace else and then spend the money to try to get them back in their community. All the research says that, all the data says that they're better off. Children and families are better off if you keep them in the community, if you serve them there, instead of pulling them out and trying to get them back in. Now, a lot of that has to do with substance abuse and all those sort of things, which I'm not going to pull you down in this afternoon. I'm happy to talk with you about that. But it's really those sort of things we've got to navigate through. But that's where we're at with Family First. And if you're your supervisor, so we're probably not going to get into licensing and a lot of these really complex issues for how do we deal with getting providers to the same place that we're trying to move the funding. But that's a big picture where we're at with Family First. And then I want to talk with you a little bit around our dashboard redesign. And so for many of you, if you've been a supervisor member or you serve on your Board of Social Services, we created a dashboard a few years ago that gave you data every month on how the agency is performing. So in your locality, you would get an updated dashboard that would say, hey, this is what your data looks like, this is what we're seeing from that. Well, what we found over the years is there were some of those measures that they weren't accurate, and then they weren't necessarily giving a full picture of the work that was going on inside of the agency. So the Commissioner was asked to pull that dashboard back, and so we've pulled that dashboard back. We're in the process of redesigning that dashboard with the partnership of our local partners to try to create a dashboard that tells a much better picture of what is going on inside of your locality, other than just their performance on, let's say, SNAP processing rates or Medicaid processing rates or how many children are in care, but give a much better picture of how that agency is actually functioning inside the community. And so we're going to put that back out to you, we're going to give that back out to you, but we were asked instead, in some of the communities, that was actually not being seen as a way to help look at the health of the organization, but it was actually being seen as not being helpful. And so we were asked to do it for one reason. It seemed like it wasn't meeting that need, so we pulled that back and are going in that direction. I'm going to ask Rebecca, and I hope you're going to cover shared accountability and your comments, right? Sure. Yeah, so would like for Rebecca to talk a little bit in her comments around the work we're doing around something called shared accountability. And just to give you some background, shared accountability actually came out of our Title 40 program, which is your large federal funding source. And we were facing, whenever I came into the Director of Family Services job, we were facing about a $25 million penalty for our performance in 4E. And so we created a group called the Shared Accountability Group that looked at how do we create a process to where we move away from those sort of penalties. And so using that guiding principle, we went from facing a $25 million penalty to where we've passed our 2 past primary federal reviews. And we had never passed a primary federal review before. And so what we have done is now taking that shared accountability conversation and moved it from 4E into how do we work through this partnership with our local agencies, and using some things that came out around the foster care review by JLARC a couple of years ago, and now the creation of of a group called the Office of the Children's Ombudsman, which provides additional oversight of localities and recommendations coming out of the office. But like Rebecca, as our partner, really talk a little bit more about that, how you see that's working, and then we'll be happy to cover anything else in our comments.
All right, thank you, Carl. I appreciate it. So I will talk about shared accountability, but what I want to talk about first is how many times Dr. Danny and Mira and Carl talked about partnership. When is the last time you have seen a local person who works in a local government sitting at a table with all of the state people? It's been a long time. It's been a long time coming. And so from a local perspective, I do want to say this is a genuine partnership. Dr. Avula has brought a new energy to the social services world. And so I do want to say with all sincerity, please, 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 this is the time that your locality can really make some gains in our human services world while we have them. So please make sure you do that. Carl is back. We have the Safe and Sound Task Force. So we are in a really good time to make some progress here. So what does everything that these folks talked about look like on the ground? So I just want to tell really quickly a story that highlights what Mira was talking about. So we have a child who's in foster care, okay? He comes into foster care because his dad says, I don't want him anymore, okay? His mom is using substances. She has no ability to take care of him. So he's 5. And his grandparents say, we'll take him. But guess what? The cute 5-year-old turns into a 12-year-old, and they can't manage his behaviors anymore. And he gets arrested. And they say he can't come back here. So he goes to a foster family. Then he gets arrested again. And they say he can't come back here. Then he starts to have mental health issues because of all the past trauma, because his mom and dad don't want him. So then he goes to their emergency room to be screened to go into a facility. And then he sits there with my workers for over 36 hours while we try and find a bed for him to go to. And then he goes to a group home and sits there for a couple of years because no one else will take him. And so that's what it looks like on the ground. So when Mira's talking about the Safe and Sound Task Force, she understated how tremendous. So this is going to become a nationwide model. I am lucky enough, Katie Boyle connected me to a national group, state supervised social services who handle child welfare. They are ecstatic about the work that Virginia is doing. They want us to come talk about it. And so I cannot tell you what partnership from the governor's office has done for local kids in our agencies. We have been asking for help for a long time, but until the governor's office said, okay, mental health and social services and Office of Children's Services, you all get together and figure this out, that's the way we're going to make real change for the kids that we serve. And guess what? That's going to be one step toward preserving those workers at your local agency, because they're not going to, hopefully, be spending 36 hours in an emergency room. And so that's going to alleviate some of the stress for our local workforce. All right, now I'm going to talk about shared accountability. So shared accountability, this started off as an argument. It did. So shared accountability sounds really nice, but what it really means to locals is when we make mistakes, we're going to have to pay for it, 100%. And so there was a large locality that I won't name because they're not in the room. But she reached out to me on a Sunday morning, and it was an email. You know, you get those emails, and this was like 5 pages. I was so shocked by this email that I called her immediately on a Sunday. She was facing penalties, and the state was going to contact not only her county administrator, but the board of supervisors about this error. So we're not talking about, you know, a major fiscal year. Turns out there was a misinterpretation of how the review was done on both parts, on both the part of the locality and the part of the state. And so what we ended up doing with Commissioner Avula's help, and Carl came in, you know, at the tail end of this, we just had a meeting. We got together, we had her, a couple of other folks, the guy who runs our social services director's finance group, and we worked on a solution and we came up with a plan. So now guess what? Localities aren't in this position where they're afraid every time they get an audit that they're going to have to come to you all and say, hey, we messed up, so I'm going to need $20,000. That's not going to happen anymore. And if it does, then I encourage you, please, to reach out to your state partners, because that is what we are trying to prevent. We are trying to go from a reactive to a proactive system. And what can you do to help your local social services directors? When they come to you and ask, can you please help me call the state? Can you please write a letter of support for this initiative? Can you please say at your board meeting, my goodness, we have 5 children in foster care waiting to be adopted. Please put the message out there, because that's how we're really going to affect real change for our system. Real quickly, recruitment and retention. I know we talk about funding, but it's not just about that. When is the last time you went to your local social services office and said thank you to the child welfare worker who probably was out all night, at least in the past week? Because I know mine have been. And I come from a very rural locality. It doesn't matter where you are in this Commonwealth. Your social services workers are out there sometimes 24/7. Sometimes just saying thank you. Encourage your local businesses. I encouraged a local church. They said, what can we do to help? I said, hey, maybe it would be nice if you did breakfast for my staff. So what did they do last week? They brought a fruit tray. I know it sounds simple, but do you know how much that meant to my staff? Do you know how many emails I got? And I do have to say, our county administrator, I do have to give him a shout out. He brought us, and it was non-alcoholic, strawberry margarita mix one Friday afternoon. And he just said, hey, I found this, have a good weekend. Wayne Jesse over here in the back, he's on our board of supervisors. Do you know, he came by this summer, we got a new air conditioning system. He said, hey, I just am stopping by to make sure it's working okay. It took 5 minutes of his time as he was riding by my office. So if I could tell you anything today, please just say thank you. And guess what? You might not know how to interact with them. You might feel strange showing up. You might not quite understand what social services does. But guess what? You're going to make a difference just by walking through those doors and saying, hey, I'm on your local board of supervisors, and I know you're making a difference for the most vulnerable folks in our community. And I think I'm going to wrap it up there and open for questions. All right?
I can't imagine what your days are like. I just can't imagine. But I'll kick it off with a question about the legislative session that's coming up. What are the legislative and budgetary priorities for the upcoming General Assembly as you all see it? So money.
Yeah. Maybe find a slide that breezed past, but one of them, and understand where we are in this process, right? Like, we have submitted our request to the Secretary's office. We've kind of gone back and forth with the Secretary. Those have then been advanced to the Governor's office, and the Governor will present his budget sometime in December to the legislature. And so I can tell you that the things that have moved to this next step, I'm not sure if they'll ultimately make it in the budget, and at that point, as members of the executive branch, we're supporting the Governor's budget. So the things that we've really identified have primarily been around continued investment in IT systems. we shared a little bit about the two systems that are getting overhauled. One that is not in there is called VACMS. This is like the basic eligibility benefit system that all of your local departments use. And even though it's not that old, 13 years or something, Carl reminded me the other day, he was like, do you know that we were still using like landlines and pagers 13 years ago, right? And it's just, it was a reminder of how much technology has changed in a short period of time. And so we're already running into a scenario where we need to make a major investment in VACMS, both for the work that our frontline benefits and eligibility folks do, but ultimately for the user experience of the residents of your communities who are trying to figure out what they're doing. So that's a big one. It's probably in total about a $50 million investment. Half of that will get covered by the feds, and so looking for about $25 million every 2 years from General Assembly. Other things are really specific to the foster care system, and so the work that Mira talked about, there's already sort of an initial investment in a professional foster parent model, in a kinship navigator program, increasing resources to help local departments reach those kinship care goals we talked about. So that was one-time funding that came in, and so part of the ask will be to sustain that funding to really bolster our kinship priorities. Some of the asks have to do with staffing, like really trying to address the supervisor to worker ratios, and to just increase the number of staff to address caseloads that some of our child welfare workers are facing. What's am I missing?
Which the Office of State Inspector General did a review of our Child Protective Services system, and they identified workforce as one of the big issues, and so we've got ask in there to help support and address some of those challenges that came out of the OSIG audit, the foster care priorities, system priorities, as you heard the Commissioner talk about. And just put a bow on that, just remember these are what we have put forward to ask for. And so in December, we will have a sense of, did they fall, some things along those lines, because there's actually some priorities that we have which didn't even make it this far. So some things that people have brought their attention they really like us to do that did not even make it to this stage. So we'll see what comes out over the next month and where it goes. But a lot of investment in our child welfare system and the systems that need to go around to support it.
As a state agency, we support the IT infrastructure for the 120 local departments. About 40 of those are in what's called a shared support relationship, and the move of these big IT systems to the cloud is going to require a new environment, new licenses, new costs to help those shared support systems be able to access all of the state systems. So one of the asks that's in there is to financially support that, so that those 40 local departments, I imagine some of you in the room are in that arrangement, can make that transition. There's some pipeline investment, like workforce pipeline. So some of you may be familiar with the stipend program, which is Carl is actually one of our stipend graduates years ago, but a way to fund BSW and MSW students and ensure that they're working in local departments that really need workers. So we have an ask in to expand that program to try to increase the pipeline of people coming in. Those are the big ones. There's one other ask that's in there has to do. You've heard some of us talk about just the real difficulty of the job and what these workers are facing every day, and a recognition that if we're going to be good employers, we've got to address that what's called secondary or vicarious trauma, right? Just as law enforcement officials are seeing and hearing really horrific things every day, our social services staff are no different. And so we are trying to adopt a model out of New Jersey where you have a warm line staffed by retired social services workers that are trauma trained and can be a support to a foster care worker who's just had a horrible couple of days dealing with a difficult situation, can pick up the phone and call somebody who understands that and can help walk them through that. So those are a handful of the budget priorities. I don't know if there's anything else.
I would just say Medicaid unwinding. We talked a lot about that. I was trying to educate a legislator, and I said unwinding, and he said, the first time I heard that term, I thought you were talking about some kind of horror movie, because unwinding has become part of our lingo. And so anyway, when you hear unwinding, it's really important. Although many of the redeterminations are going to be automated, guess what? The hardest ones are coming to your local agencies. And so it's going to take them a lot of time to sift through all of that data for each of those cases. And so there is a big ask that PDSS put in for some overtime and other funding to support that work locally.
Okay. Let's take some questions from the audience. I apologize, we don't have a mic that's mobile, so.
I want to thank y'all for showing up, and Carl, welcome back. Carl and I go way back, so he's had to put up with me many, many years. Ms. Morgan touched on it.
And you've had to put up with him too, so.
Usually it's the other way around. He'll tell you some story. Ms. Morgan touched on our greatest asset a little bit, and when we're talking about infrastructure, our employees. I served on the board of supervisors, but I've served on the social services board off and on many times. One of the problems we run into our salaries, it's hard to compete. But one of the biggest things we're running into is the benefits program. Like many counties, we have pretty good insurance with a single employee. The family plans are so outrageous in cost, we can't cover it alone, even attempt to. So I ask, when you get into the salaries and you talk about infrastructure, don't forget about that benefit package as well, because it's a major thing. We sometimes forget these people, they have families too. And they're dealing with all this stuff like you're talking about. Yes, we have programs set up through the Community Services Board, where I'm a member also, where we have psychiatric help available if they want it, and that kind of like we did when you were there, Carl. We've expanded it. But don't forget about the benefit packages. Anything you can do to help local government, it helps us. We've had people turn jobs down simply because of that family plan premium, both in regular and our other jobs in the county and with social services. So just don't forget that aspect of it.
Yeah, thank you, Jerry. It's really, really important. And every locality is dealing with, every business is dealing with increasing healthcare costs. I don't know if, have there ever been efforts by NACO or other coalitions to try to expand the risk pool and have multiple organizations go in together to lower those costs?
Well, I don't know if NACO expressed it, but we've looked at going into the schools. We've discussed, we're in the New River Valley, we've discussed trying to go in, use the planning district conventions, but we went out on our own and put RFPs out for insurance, and we've got the best deal out there we can get. It's just that the family plan or the insurance is just so outrageous, it is.
Yeah, I guess from our end, what I'm taking away is that if we're going to advocate for increased salaries or increased resources for local departments, we need to factor in the cost of covering things.
Yes, to help out. If you could help them out, we could come up with a little as counties and the state come up with part of it. Then you might find that some of these people that are coming into this area or graduating from it, that have families, they might be more interested in a rural area than they might be in more urban, purely from a caseload, but that's increasing in the local areas too, so
My name is Mira. I'm Accomack County, and I guess I'm in a very unique situation when it comes to social services. I serve on the Board of Supervisors for my election District 9, but I work in a local agency in Northampton, social services. I do child care and I do canopy. But I also, I work in my neighboring county, which is Northampton County, but I also sit on the Accomack County Social Services Board, and I chair it right now. So I have
great
my
perspective.
roles, and I know my different roles. But I do want to mimic what my colleague said about the benefit. It bothers me. I'm a 30-year veteran in social services. But I see my new young social workers or family services specialists, is how we term them, come in and they have to get on SNAP. They're eligible for SNAP. Okay, because these are young families who are just trying to make it. Some of them are single mothers who have tried to better themselves. And yes, they may have 3 or 4 children, so they're eligible for SNAP or the child care subsidy. Can you imagine you working for social services, but you also eligible for benefit? How that can make you feel? So I do want to advocate for that. And I was glad to hear you say something about the Virginia case management system. So, all the latency that can happen.
Yeah.
But I also want to be it started off doing child care and not total benefits. So I can go way back. And, but I love social services. Dr. Danny, I don't want to look at the last name. I've been on a lot of webinars that you have. I just think you're remarkable. I really applaud you. And I will never forget Ms. Morgan, and I call it Ayers since they've been around forever. Everybody who anything knows social services doesn't call it Ayers. But are you the league president as far as director? I can't go back until Vicki, who's the Accomack County social services director, on my director, Ms. Ella Francis, how much energy that you have. But she is certainly right, and I do admonish all of you, please go by your local social service. That's hard work that they do. And all this, I have friends, you know, some of my teachers, I'm not trying to friends all the time, but I look, some of my colleagues that do tangible reviews, some of those folks were hired in COVID. They know nothing about real policy. So the training and they have to, and we're starting January 1. So they're going to have to learn all of that policy, and you know, it's overwhelming to some of them. You'll work it out. But I'm from a small agency, so basically I have people who I'm trying to train these young ladies with child care. But basically I'm doing the child care work in the canopy work. But I just applaud you, and as all of you say, please visit your local social services and do some of those kind things that buy breakfast or something simple. Thank you card is really needed and really appreciative of it. Thank you.
I think we have time for one more question.
Dr. Avula, you talked about the child care spectrum, and how do you and what are you looking for in those early stages of prevention? What are your targets in terms of what you want to do as a public announcement or public education, or specifically identifying people before you do that? What's your approach to that?
Yeah, in our parlance, it means more in-home services cases, right? When we get a CPS complaint, your investigation starts, and then that worker, the investigator, is trying to decide, does this need to go into foster care, or is there an in-home route where we can find community-based preventive services and really support that family?
So it's still initiated by a CPS call?
Unfortunately for us, it is. I think there's lots of places, schools, you know, other sort of family-serving agencies, the nonprofit sector, that could identify families for those services. But for the social services pathway, that is started by CPS. Are there other ways that we can
So
get
we
at
would
that?
encourage teachers and other people who deal with this to contact social services for early identification.
So the Department of Education has a ton of early childhood initiatives, one of which is the Early Head Start program. And that can start as early as 6 months. And even in my rural county of Middlesex, the school couldn't stand it up, so we have an in-home childcare provider that does it. It can be opened or done in any locality, and it can start at 6 months at no cost to the family. There's a case manager who follows that child from 6 months until they start school. So the Department of Ed, if you Google it, DOE Childcare Initiatives, there's a whole web page. But that moved over to the Department of Ed from BDSS a couple of years ago. But great question.
Yeah, and the last thing I would add for you to consider as a community is that if you're waiting to the point that you're making the report to the Child Protective Service Agency, is the family is already in crisis. So what you're dealing with is a response to a crisis situation that's occurring. So as a community, and whichever way you go into, whether it's the school system, which tends to see the most of our children, daycare providers, pediatricians, churches is a wonderful place, your YMCA's, your rec centers, whatever it is that you see children and families. When you start identifying a family that you think is in need or something along those lines, then as a community, you start putting services in place as a community and not waiting until they get into crisis. Because the crisis response is abuse or neglect has already happened.
So the Department of Social Services is still the one that needs to coordinate the potential services.
No, it doesn't have to be. That's where we're trying to get communities to think about it more broadly. Is the community can establish prevention coalitions, they can put things in place before that thing happens. The Department of Social Services has a funding stream that is related to only if the child is at risk of coming into foster care. That's where Family First gets to. Whenever I was speaking to you earlier around the theoretical change, is that we want to support children and families before they get to the fact that the child is almost ready to come out of the home. And you can do a lot of early prevention like Rebecca was talking about, but you can also do it when children are at risk and you're identifying they need supports. And I'll give you the 3 basic things that keep a child from coming into care. One is that you have safe and stable housing. Has nothing to do with social services. 2, they know where their next meal is coming. They're fed. And then 3, they've got somebody that cares for them. A family member, we use the term kin or fictive kin. If you can focus on those 3 areas, you can really reduce the need for
If you look at a situation where there's somebody maybe losing their home, that may be the first stage. I would look at that and see what you can do about that before you get to the medium child service. Thank you.
Yes, sir.
Thank you all so much for being here today. You're a wealth of knowledge. We appreciate it so much.